morning, everyone. It's delightful to be back at the Ophthalmology Innovation Summit. We're going to talk about diagnostics, and I'm going to start with a bit of an overview, and I would like to thank David Harmon, who will also be part of our discussion panel, for helping put this together. We're going to hear from some of the market leaders in the diagnostic area, and then have an interesting panel discussion. So, global revenues in ophthalmic diagnostics continue to grow, and we can see relatively nice advancement here over the past few years. So there is a growing opportunity in revenues worldwide. And the segments break out, as you might imagine, and we're going to talk about each of them as we go along here. But there's a lot of products, about 700 diagnostic products, 85 manufacturers, so the barriers to entry here may be somewhat lower than they are in some other areas, and a large number of product categories that can be approached. But if we look at the top four, it's basically OCT, fundus imaging, operating microscopes, and optical biometry. And we're going to focus on those a little bit in our discussion. Growth continues in all of these revenue segments, and so any of them can give a return to an investor. And in particular, as I mentioned, there's been a good deal of investment into fundus imaging, OCT, optical biometry, and operating microscopes and attachments to operating microscopes. So again, we're going to focus on those topics as they seem to be one of the larger areas of interest, particularly as we approach the premium channel. Again, we mentioned that there were 700 companies, but there certainly are a small number of market leaders, and Carl Zeiss Meditech is the market leader in this particular arena. But there are several others involved, and it does look, as I look at it, as being an area where perhaps the barrier to entry is somewhat less, and we already saw this morning several companies in this particular arena that are coming with new and innovative products. So diagnostics are definitely increasingly important. We'll talk about that in the discussion panel, but we are all in our practices, as we practice every day, seeing patients using more and more preoperative diagnostics in our planning, and also more intraoperative diagnostics in our surgery, and also more diagnostics postoperatively as well. And this is new technology that are definitely creating opportunities and helping us grow the marketplace as we can generate better outcomes both for our presbyopia correcting IOLs, but also our astigmatism correcting IOLs, and also in corneal refractive surgery.